My name's James. I'm 23 years old and I'm a staff wellbeing engagement administrator. So when I turned 19, 20, I joined St Basil's homeless charity, and I left there when I turned 21 after COVID. Through that I joined the Youth Advisory Programme, so it's kind of like their programme involving the youth to help change the organisation. And the lady called Taz there, she knew I was going to join the police, but I got rejected last minute. She then asked me if I joined the NHS and have an interview with NHS. Initially I thought no, because when you think NHS you think blood and nurses, and I think, well, I don't like blood, so what do I want to do that for? But that kind of introduced me to the background in NHS, the corporate structure, which I never knew anything about before. And since October 2022, I've been involved in the wellbeing team. Yeah, so my journey since I joined BWC, it's been really positive. So we started in January. I went to Downing Street to represent Birmingham and Children's Trust as a care leaver, which is an experience I never thought I'd have 2 months since joining my role. Further down the line, I became more involved in staff activities, so I became involved in the trust induction, which I still do today. I've had the privilege of meeting the Villa players, which as a Villa fan was massive for me. I missed them last year, so I got them this year. I recently took part in doing a BBC interview for National Care Leavers Week, which I think I'm always going to be proud of. So my role on a day-to-day basis at the moment is we've got a staff wellbeing element. So every first Wednesday of each month I take part in what we call Wellbeing Wednesday, where we go out and support the staff in the wellbeing hub. And then other than that, we do the trust induction. So that's incorporating the new starters into the trust as part of the introduction. I think in the time I've had so far, I think it's that professional mindset that I developed. I think when I first came into the role, I knew nothing about the NHS. And I think my knowledge has developed quite widely, not just about the NHS, but how it supports its staff. And I think as a member of the public before, I never really saw that. So having that knowledge now, and to see how hard people work in the NHS, it's something I never knew about before. But also having like a care leave experience, it's allowed me to show empathy towards a lot of things that I'd never had to show empathy towards before. So I've actually helped employ care leavers into the trust, someone that I lived with, which I found really positive. I think the support that I've had, it's been very low key. It's not been we're here to help you. It's been more we just see you as a normal person, and I think above all that's the most important. I never wanted to come into the trust and be treated differently because I was a care leaver, or have kind of a hand round my shoulder to say you're a care leaver, we're here to support you. When I came in, I just wanted to be normal, and I think having to be treated normal is something that I've found really positive. I think as a care leaver, I think opportunities are really difficult to find, because I feel like there's a stigmatisation there, because I feel like people think if your parents can't look after you, how can you look after you? And I think that's always a thing I grew up with when I was in school. So I think coming to my 20s now, I'm 23 years old now, and it's the first opportunity I've had. So I think having a care leaver coming around has been really positive, not just for my development, but for others as well.